Hi, everyone. This is Nurse Anna from nursecity.net, and here's the long-awaited Maternity NCLEX NGN test questions with answers and rationales. 75 questions here. Enjoy.
Would you like free audiobooks? Click the link in the description. Question 1. A patient at 36 weeks of gestation presents to the emergency department with severe headache, visual disturbances, and upper abdominal pain. Her blood pressure is 165 over 110 millimeters of mercury, and she has 3+ proteinuria. What is the most appropriate nursing intervention? A. Administer IV magnesium sulfate as ordered. B. Prepare the patient for an emergency cesarean section. C. Initiate seizure precautions and continuous fetal monitoring. D. Provide patient education on preeclampsia and its management. Answer: C. Rationale: the patient is presenting with severe preeclampsia, which places her at high risk for eclampsia, seizures. Initiating seizure precautions and continuous fetal monitoring are critical to prevent complications. While magnesium sulfate and cesarean delivery may be necessary, these require provider orders. Question 2. A pregnant woman at 28 weeks gestation presents with painless vaginal bleeding. An ultrasound confirms placenta previa. What is the priority nursing action? A. Perform a digital vaginal exam to assess bleeding. B. Start an IV line and prepare for possible blood transfusion. C. Place the patient in Trendelenburg position. D. Educate the patient on the need for bed rest and possible hospitalization. Answer: B. Rationale: the priority is to ensure the patient is stable and prepared for any necessary interventions, such as a blood transfusion, due to the risk of significant bleeding. A digital exam is contraindicated due to the risk of causing further bleeding. Question 3. A 32-year-old prima gravida at 20 weeks gestation has been diagnosed with gestational diabetes mellitus, GDM. Which patient statement indicates a need for further teaching? A. I will monitor my blood glucose levels 4 times a day. B. I need to avoid all carbohydrates to control my blood sugar. C. Exercise can help control my blood sugar levels. D. I may need insulin if diet and exercise are not enough. Answer: B. Rationale: avoiding all carbohydrates is not recommended. Patients with GDM need to manage carbohydrate intake and choose complex carbohydrates while monitoring blood glucose levels. This statement indicates a misunderstanding of dietary management in GDM. Question 4. A nurse is caring for a patient in active labor who is receiving oxytocin to augment labor. The patient's contractions are 90 seconds long and occur every 1.5 minutes. What should be the nurse's first action? A. Increase the oxytocin infusion rate. B. Discontinue the oxytocin infusion. C. Administer oxygen at 10 liters per minute by a non-rebreather mask. D. Encourage the patient to ambulate to progress labor. Answer: B. Rationale: the patient is experiencing uterine tachysystole, excessively frequent contractions, which can compromise fetal oxygenation. The priority action is to discontinue oxytocin to reduce contraction frequency and improve fetal oxygenation. Question 5. A patient at 34 weeks gestation presents with sudden onset of severe abdominal pain, uterine tenderness, and a firm, board-like abdomen. Fetal heart tones are non-reassuring. What condition is suspected, and what is the immediate nursing action? A. Placental abruption: initiate continuous fetal monitoring and prepare for emergency delivery. B. Uterine rupture: start IV fluids and prepare for surgical intervention. C. Preterm labor: administer tocolytics to stop contractions. D. Chorioamnionitis: administer antibiotics and monitor for signs of sepsis. Answer: A. Rationale: the symptoms suggest placental abruption, a serious condition requiring immediate intervention to prevent maternal and fetal complications. Continuous fetal monitoring and preparation for emergency delivery are critical. Question 6. A patient with a history of preeclampsia in a previous pregnancy is at her first prenatal visit for the current pregnancy. Which laboratory test should be prioritized? A. Complete blood count, CBC. B. Urinalysis for protein. C. Fasting blood glucose. D. Blood type and Rh factor. Answer: B. Rationale: since the patient has a history of preeclampsia, early detection of proteinuria can help in the early diagnosis and management of preeclampsia in the current pregnancy. Question 7. A nurse is assessing a patient in the third trimester who reports feeling short of breath when lying flat and has swelling in her hands and feet. Which condition should the nurse be most concerned about? A. Anemia. B. Preeclampsia. C. Gestational diabetes. D. Peripartum cardiomyopathy. Answer: D. Rationale: shortness of breath when lying flat and swelling can be signs of peripartum cardiomyopathy, a serious condition affecting the heart during the last month of pregnancy or the first few months postpartum. Question 8. A 26-year-old G2P1 patient at 37 weeks gestation presents with sudden, painless vaginal bleeding. What diagnostic procedure is contraindicated? A. Transabdominal ultrasound. B. Non-stress test. C. Digital vaginal examination. D. CBC and coagulation profile. Answer: C. Rationale: a digital vaginal examination is contraindicated in cases of suspected placenta previa due to the risk of provoking severe bleeding. Question 9. A patient at 30 weeks gestation presents with a severe headache, blurred vision, and oliguria. Her blood pressure is 170/105 mm of mercury. What is the priority nursing diagnosis? A. Risk for infection related to invasive procedures. B. Fluid volume deficit related to decreased fluid intake. C. Risk for injury related to altered level of consciousness. D. Ineffective tissue perfusion related to hypertension. Answer: D. Rationale: ineffective tissue perfusion is the priority due to severe hypertension, which can lead to complications for both the mother and fetus. Question 10. A nurse is caring for a patient who just delivered a healthy newborn. The patient is now experiencing heavy vaginal bleeding and a boggy uterus. What is the first action the nurse should take? A. Increase the IV fluid rate. B. Administer oxytocin as ordered. C. Massage the uterus firmly. D. Notify the healthcare provider. Answer: C. Rationale: a boggy uterus indicates uterine atony, which is a leading cause of postpartum hemorrhage. Massaging the uterus helps to stimulate contractions and reduce bleeding. Question 11. A pregnant patient at 32 weeks presents with preterm labor symptoms. Which medication is expected to be administered to promote fetal lung maturity? A. Betamethasone. B. Magnesium sulfate. C. Terbutaline. D. Indomethacin. Answer: A. Rationale: betamethasone is a corticosteroid given to accelerate fetal lung maturity in cases of threatened preterm birth. Question 12. A patient at 40 weeks gestation is in labor and reports severe back pain. The nurse suspects the fetus is in the occiput posterior (OP) position. Which intervention is most appropriate? A. Apply a warm compress to the patient's lower back. B. Encourage the patient to lie supine with knees bent. C. Assist the patient into a hands and knees position. D. Perform continuous fetal monitoring. Answer. C. Rationale: the hands and knees position can help rotate the fetus to an occiput anterior position, relieving the back pain associated with OP position. Question 13. A 35-year-old woman at 10 weeks gestation has a history of recurrent pregnancy loss. Which intervention is most critical at this point in her pregnancy? A. Prescribe low-dose aspirin therapy. B. Schedule a detailed ultrasound examination. C. Perform a cervical circlage procedure. D. Advise complete bed rest until the second trimester. Answer. A. Rationale: low-dose aspirin therapy is often prescribed to prevent pregnancy loss associated with antiphospholipid syndrome or other clotting disorders. Question 14. A patient at 18 weeks gestation presents with severe nausea and vomiting, weight loss, and dehydration. What is the most likely diagnosis? A. Gestational diabetes mellitus. B. Hyperemesis gravidarum. C. Preeclampsia. D. Placenta previa. Answer. B. Rationale: severe nausea and vomiting, weight loss, and dehydration are classic symptoms of hyperemesis gravidarum, a condition requiring medical intervention. Question 15. A nurse is caring for a patient who is receiving magnesium sulfate for severe preeclampsia. Which assessment finding would indicate magnesium toxicity? A. Deep tendon reflexes of +3. B. Respiratory rate of 10 breaths per minute. C. Urinary output of 45 milliliters per hour. D. Blood pressure of 150/90 millimeters of mercury. Answer. B. Rationale: a respiratory rate of 10 breaths per minute indicates possible magnesium toxicity, as magnesium sulfate can depress the central nervous system and respiratory function. Question 16. A patient with gestational diabetes is admitted in labor. Which fetal complication is the nurse most concerned about? A. Fetal macrosomia. B. Fetal anemia. C. Neural tube defects. D. Oligohydramnios. Answer. A. Rationale: gestational diabetes increases the risk of fetal macrosomia, large for gestational age, which can lead to delivery complications. Question 17. A nurse is monitoring a patient with oligohydramnios. What is the priority nursing assessment? A. Fetal heart rate monitoring. B. Assessing maternal weight gain. C. Monitoring for signs of infection. D. Evaluating maternal blood pressure. Answer. A. Rationale: oligohydramnios, low amniotic fluid, can cause cord compression, making fetal heart rate monitoring essential to assess fetal well-being. Question 18. A patient at 34 weeks gestation has a history of hypertension and presents with sudden epigastric pain and altered mental status. What complication should the nurse suspect? A. HELP syndrome. B. Gestational diabetes. C. Placenta previa. D. Chorioamnionitis. Answer. A. Rationale: HELLP syndrome, hemolysis, elevated liver enzymes, low platelets, presents with symptoms such as epigastric pain and altered mental status, and requires immediate intervention. Question 19. A patient at 30 weeks gestation is diagnosed with intrauterine growth restriction, IUGR. Which intervention is most appropriate? A. Schedule weekly non-stress tests, NSTs, and biophysical profiles, BPPs. B. Advise increased caloric intake and bed rest. C. Initiate corticosteroid therapy. D. Administer magnesium sulfate for fetal neuroprotection. Answer A. Rationale: weekly NSTs and BPPs are used to closely monitor fetal well-being in cases of IUGR to ensure timely intervention if fetal distress is detected. Question 20. A patient at 38 weeks gestation presents with heavy bleeding and abdominal pain. The nurse suspects placental abruption. Which diagnostic test should be avoided? A. Ultrasound examination. B. Coagulation profile. C. Digital vaginal examination. D. Non-stress test. Answer C. Rationale: digital vaginal examination is contraindicated in suspected placental abruption due to the risk of exacerbating the bleeding. Question 21. A nurse is providing discharge teaching to a patient diagnosed with preterm premature rupture of membranes, PPROM, at 32 weeks. Which instruction is most important? A. Avoid intercourse and any vaginal insertion. B. Take your temperature twice daily and report any elevation. C. Monitor for any changes in fetal movement. D. Increase your fluid intake to stay hydrated. Answer B. Rationale: monitoring temperature for signs of infection is critical in patients with PPROM due to the increased risk of chorioamnionitis. Question 22. A nurse is caring for a patient with severe preeclampsia on magnesium sulfate therapy. Which of the following is a sign of magnesium toxicity? A. Tachycardia. B. Hyperreflexia. C. Respiratory depression. D. Elevated blood pressure. Answer C. Rationale: respiratory depression is a key sign of magnesium toxicity and requires immediate intervention. Question 23. A pregnant patient at 24 weeks presents with painless vaginal bleeding. Ultrasound reveals a complete placenta previa. What should be included in the patient's teaching? A. You will need to stay on complete bed rest for the remainder of your pregnancy. B. Avoid sexual intercourse and heavy lifting. C. You may continue with your normal activities as long as you feel comfortable. D. Frequent walking will help manage your symptoms. Answer B. Rationale: patients with placenta previa should avoid activities that could trigger bleeding, such as sexual intercourse and heavy lifting. Question 24. A nurse is caring for a patient with preeclampsia. Which laboratory result would be most concerning? A. Platelet count of 90,000. B. Hemoglobin of 11. C. White blood cell count of 12,000. D. Blood glucose level of 100. Answer A. Rationale: a low platelet count is concerning in preeclampsia and may indicate HELP syndrome, requiring immediate medical attention. Question 25. A patient with a history of gestational hypertension is now at 36 weeks gestation and presents with new-onset facial swelling and 2+ proteinuria. What is the priority nursing action? A. Place the patient on bed rest and reassess in 1 hour. B. Administer antihypertensive medication as ordered. C. Obtain blood samples for liver function tests and platelet count. D. Provide patient education on preeclampsia management. Answer C. Rationale: new-onset facial swelling and proteinuria indicate possible progression to preeclampsia. Obtaining blood samples for liver function and platelet count helps diagnose and manage potential complications. Question 26. A nurse is educating a patient at 34 weeks gestation with a history of preterm labor. Which statement by the patient indicates a need for further teaching? A. I should notify my healthcare provider if I experience more than 4 contractions in 1 hour. B. I can continue working as long as I feel comfortable. C. I need to stay hydrated and rest as much as possible. D. I should avoid lifting heavy objects or standing for long periods. Answer. B. Rationale. Continuing to work without restrictions may not be advisable for a patient with a history of preterm labor. This statement indicates a need for further teaching on activity limitations. Question 27. A patient at 39 weeks gestation is in active labor and has a history of herpes simplex virus (HSV) infection. She has active lesions. What is the priority intervention? A. Administer acyclovir as ordered. B. Prepare for a cesarean delivery. C. Apply topical antiviral ointment. D. Perform continuous fetal heart rate monitoring. Answer. B. Rationale. Active HSV lesions during labor necessitate a cesarean delivery to prevent neonatal herpes infection. Question 28. A nurse is assessing a patient with suspected ectopic pregnancy. Which finding is most indicative of this condition? A. Lower abdominal pain and shoulder pain. B. Elevated HCG levels and uterine enlargement. C. Severe vomiting and dehydration. D. Hypertension and proteinuria. Answer. A. Rationale. Lower abdominal pain and referred shoulder pain are classic signs of a ruptured ectopic pregnancy, requiring immediate intervention. Question 29. A patient at 37 weeks gestation presents with hypertension and sudden onset of right upper quadrant pain. Which laboratory test result would most support a diagnosis of HELLP syndrome? A. Elevated liver enzymes. B. Increased white blood cell count. C. Low fasting blood glucose. D. Elevated hematocrit. Answer. A. Rationale. Elevated liver enzymes are a key component of HELLP syndrome, hemolysis, elevated liver enzymes, low platelets, indicating liver involvement. Question 30. A nurse is caring for a patient with gestational diabetes. Which fetal complication should the nurse monitor for during labor? A. Fetal hypoglycemia. B. Fetal anemia. C. Fetal macrosomia. D. Fetal hyperbilirubinemia. Answer. C. Rationale. Gestational diabetes increases the risk of fetal macrosomia, large for gestational age, which can lead to delivery complications. Question 31. A patient with gestational hypertension is admitted at 38 weeks gestation with a severe headache and blurred vision. Which medication is most likely to be ordered? A. Labetalol. B. Insulin. C. Betamethasone. D. Nifedipine. Answer. A. Rationale. Labetalol is commonly used to manage severe hypertension in pregnant patients to prevent complications like eclampsia. Question 32. A nurse is caring for a patient who is 10 weeks postpartum and experiencing heavy bleeding with clots. Which condition should the nurse suspect? A. Endometritis. B. Retained placental fragments. C. Subinvolution of the uterus. D. Thrombophlebitis. Answer. B. Rationale. Heavy postpartum bleeding with clots can indicate retained placental fragments, which prevent the uterus from contracting effectively. Question 33. A patient at 28 weeks gestation presents with preterm labor. Which medication is administered to provide neuroprotection for the fetus? A. Magnesium sulfate. B. Betamethasone. C. Terbutaline. D. Indomethacin. Answer. A. Rationale. Magnesium sulfate is given to preterm labor patients for fetal neuroprotection, particularly to reduce the risk of cerebral palsy. Question 34. A patient at 24 weeks gestation with type 1 diabetes is admitted with hyperglycemia. Which fetal complication is the nurse most concerned about? A. Macrosomia. B. Congenital anomalies. C. Fetal anemia. D. Oligohydramnios. Answer B. Rationale: poorly controlled type 1 diabetes increases the risk of congenital anomalies due to hyperglycemia's teratogenic effects in the first trimester. Question 35. A nurse is assessing a pregnant patient with suspected chorioamnionitis. Which finding is most indicative of this condition? A. Elevated blood pressure. B. Foul-smelling amniotic fluid. C. Decreased fetal movement. D. Proteinuria. Answer B. Rationale: foul-smelling amniotic fluid is a classic sign of chorioamnionitis, an infection of the amniotic sac, requiring prompt treatment. Question 36. A patient with preeclampsia is receiving magnesium sulfate therapy. What is the most important nursing assessment? A. Blood pressure monitoring. B. Deep tendon reflexes. C. Blood glucose levels. D. Hemoglobin and hematocrit. Answer B. Rationale: monitoring deep tendon reflexes is crucial to assess for magnesium toxicity, which can lead to respiratory depression and other complications. Question 37. A nurse is educating a patient with gestational diabetes about the potential need for insulin therapy. Which patient statement indicates an understanding of the teaching? A. I will likely need insulin only if my blood sugar levels remain high despite diet and exercise. B. Insulin therapy means I have to eat more carbohydrates to balance it. C. Once I start insulin, I can stop monitoring my blood glucose levels. D. I should avoid any physical activity while on insulin therapy. Answer A. Rationale: insulin therapy is often necessary when diet and exercise are insufficient to control blood glucose levels in gestational diabetes. Question 38. A patient at 33 weeks gestation presents with preterm premature rupture of membranes, PPROM. What is the primary nursing intervention? A. Administer corticosteroids to accelerate fetal lung maturity. B. Begin antibiotic therapy to prevent infection. C. Prepare for immediate delivery. D. Advise complete bed rest until delivery. Answer B. Rationale: antibiotic therapy is essential in PPROM to prevent infection, which poses significant risks to both mother and fetus. Question 39. A nurse is caring for a patient with suspected intrahepatic cholestasis of pregnancy. Which symptom is most characteristic of this condition? A. Severe itching, especially on the palms and soles. B. Persistent vomiting and dehydration. C. Elevated blood pressure and proteinuria. D. Painless vaginal bleeding. Answer A. Rationale: severe itching, particularly on the palms and soles, is a hallmark symptom of intrahepatic cholestasis of pregnancy, requiring prompt medical management. Question 40. A patient at 28 weeks gestation presents with preeclampsia. Which complication is the nurse most concerned about? A. Placental abruption. B. Gestational diabetes. C. Preterm labor. D. Chorioamnionitis. Answer A. Rationale: preeclampsia significantly increases the risk of placental abruption, a serious condition that requires immediate intervention. Question 41. A nurse is providing postpartum care for a patient who had a cesarean delivery. The patient is now experiencing heavy vaginal bleeding and tachycardia. What is the priority nursing action? A. Administer oxytocin as ordered. B. Monitor vital signs every 15 minutes. C. Assess the uterine fundus for firmness. D. Notify the healthcare provider immediately. Answer: C. Rationale: assessing the uterine fundus for firmness is critical to determine if uterine atony is causing the bleeding, which is a common cause of postpartum hemorrhage. Question 42. A patient at 34 weeks gestation with a history of preterm labor is receiving tocolytic therapy. Which finding would be most concerning? A. Maternal tachycardia. B. Mild uterine contractions. C. Elevated white blood cell count. D. Shortness of breath. Answer: D. Rationale: shortness of breath can indicate a serious adverse effect of tocolytic therapy, such as pulmonary edema, requiring immediate intervention. Question 43. A nurse is assessing a patient at 38 weeks gestation with gestational hypertension. Which symptom indicates a potential complication requiring urgent intervention? A. Proteinuria. B. Edema in the lower extremities. C. Headache and visual disturbances. D. Elevated fasting blood glucose. Answer: C. Rationale: headache and visual disturbances in a patient with gestational hypertension suggest severe preeclampsia, which requires urgent intervention to prevent complications. Question 44. A patient at 36 weeks gestation presents with itching and jaundice. Which laboratory test is most relevant? A. Complete blood count, CBC. B. Liver function tests, LFTs. C. Urinalysis. D. Blood glucose levels. Answer: B. Rationale: liver function tests are crucial to assess for intrahepatic cholestasis of pregnancy, which presents with symptoms of itching and jaundice. Question 45. A nurse is caring for a patient in labor with suspected cephalopelvic disproportion, CPD. What is the priority nursing intervention? A. Prepare the patient for a potential cesarean section. B. Encourage ambulation to facilitate labor progression. C. Administer oxytocin to augment labor. D. Apply a warm compress to the lower back. Answer: A. Rationale: suspected cephalopelvic disproportion may necessitate a cesarean section to prevent complications during delivery, making preparation for surgery a priority. Question 46. A nurse is monitoring a patient with severe preeclampsia receiving magnesium sulfate. Which symptom would indicate the need to discontinue the medication? A. Increased deep tendon reflexes. B. Respiratory rate of 12 breaths per minute. C. Urinary output of 50 milliliters per hour. D. Blood pressure of 160 over 100 millimeters of mercury. Answer: B. Rationale: a respiratory rate of 12 breaths per minute indicates potential magnesium toxicity, requiring discontinuation of the medication and further assessment. Question 47. A patient at 30 weeks gestation is admitted with severe preeclampsia. Which laboratory finding is most concerning? A. Hemoglobin of 12. B. Platelet count of 100,000. C. Blood glucose level of 90. D. White blood cell count of 11,000. Answer: B. Rationale: a low platelet count is concerning in severe preeclampsia and may indicate HELP syndrome, requiring immediate medical intervention. Question 48. A patient with a history of recurrent miscarriages is now 8 weeks pregnant. What is the most important intervention at this stage? A. Prescribe progesterone supplements. B. Schedule a detailed ultrasound examination. C. Perform genetic testing. D. Advise complete bed rest. Answer A. Rationale: progesterone supplements can help maintain the pregnancy in cases of recurrent miscarriages, especially in the first trimester. Question 49. A patient at 37 weeks gestation presents with a fever, tachycardia, and foul-smelling amniotic fluid. What is the nurse's priority action? A. Administer broad-spectrum antibiotics. B. Perform a digital vaginal examination. C. Prepare the patient for delivery. D. Monitor fetal heart rate continuously. Answer A. Rationale: administering antibiotics is essential in treating chorioamnionitis, an infection of the amniotic fluid, to prevent maternal and fetal complications. Question 50. A patient at 35 weeks gestation presents with sudden severe abdominal pain and a rigid, board-like abdomen. What should the nurse suspect? A. Placental abruption. B. Uterine rupture. C. Preterm labor. D. Chorioamnionitis. Answer A. Rationale: severe abdominal pain and a rigid abdomen are indicative of placental abruption, a medical emergency requiring immediate intervention. Question 51. A patient at 32 weeks gestation is diagnosed with preterm labor. Which medication is administered to accelerate fetal lung maturity? A. Betamethasone. B. Magnesium sulfate. C. Terbutaline. D. Nifedipine. Answer A. Rationale: betamethasone is a corticosteroid given to accelerate fetal lung maturity in cases of threatened preterm birth. Question 52. A patient at 40 weeks gestation presents in active labor with a history of group B streptococcus, GBS, colonization. What is the most appropriate intervention? A. Administer IV antibiotics as ordered. B. Perform continuous fetal heart rate monitoring. C. Prepare for a cesarean section. D. Initiate oxytocin to augment labor. Answer A. Rationale: administering IV antibiotics is crucial to prevent neonatal GBS infection during delivery. Question 53. A patient at 34 weeks gestation is admitted with severe preeclampsia and develops seizures. What is the priority nursing intervention? A. Place the patient in a lateral position and protect her airway. B. Administer magnesium sulfate as ordered. C. Monitor fetal heart rate continuously. D. Prepare for an emergency cesarean section. Answer A. Rationale: the priority during a seizure is to protect the patient's airway and prevent injury. Administering magnesium sulfate and preparing for delivery are important but come after stabilizing the patient. Question 54. A patient at 26 weeks gestation with gestational diabetes reports feeling dizzy and lightheaded. What should the nurse assess first? A. Blood pressure. B. Blood glucose level. C. Fetal heart rate. D. Urinalysis. Answer B. Rationale: symptoms of dizziness and lightheadedness in a patient with gestational diabetes may indicate hypoglycemia, making blood glucose assessment a priority. Question 55. A nurse is assessing a patient with a suspected molar pregnancy. Which finding is most characteristic of this condition? A. Hyperemesis gravidarum. B. Elevated blood pressure. C. High HCG levels for gestational age. D. Painless vaginal bleeding. Answer C. Rationale: high HCG levels for gestational age are characteristic of molar pregnancy, a condition requiring prompt medical management. Question 56. A nurse is caring for a patient with severe preeclampsia. Which assessment finding would be most concerning? A. Deep tendon reflexes of +4. B. Blood pressure of 150/90 mm of mercury. C. Urinary output of 30 milliliters per hour. D. Platelet count of 150,000. Answer: A. Rationale: hyperreflexia, deep tendon reflexes of +4, indicates severe central nervous system involvement, increasing the risk of seizures and requiring immediate attention. Question 57. A patient at 28 weeks gestation with preeclampsia is admitted with HELLP syndrome. Which laboratory result is most indicative of this condition? A. Elevated liver enzymes. B. Increased white blood cell count. C. Low fasting blood glucose. D. High hematocrit. Answer: A. Rationale: elevated liver enzymes are a key component of HELLP syndrome, hemolysis, elevated liver enzymes, low platelets, requiring immediate intervention. Question 58. A patient at 32 weeks gestation presents with painless vaginal bleeding. What is the most appropriate initial nursing intervention? A. Perform a digital vaginal examination. B. Start an IV line and prepare for possible blood transfusion. C. Place the patient in Trendelenburg position. D. Educate the patient on the need for bed rest and possible hospitalization. Answer: B. Rationale: the priority is to ensure the patient is stable and prepared for any necessary interventions, such as a blood transfusion, due to the risk of significant bleeding. Question 59. A patient at 36 weeks gestation presents with sudden onset of severe abdominal pain and vaginal bleeding. The nurse suspects placental abruption. What is the priority nursing action? A. Administer oxygen and start an IV line. B. Prepare the patient for an emergency cesarean section. C. Monitor maternal vital signs and fetal heart rate. D. Provide emotional support to the patient and family. Answer: A. Rationale: administering oxygen and starting an IV line are critical to stabilize the patient and prepare for potential emergency interventions. Question 60. A patient at 40 weeks gestation is admitted in labor with a history of preeclampsia. She suddenly develops a severe headache, blurred vision, and epigastric pain. What is the priority nursing action? A. Administer antihypertensive medication as ordered. B. Prepare for immediate delivery. C. Monitor fetal heart rate continuously. D. Notify the healthcare provider immediately. Answer: D. Rationale: the sudden onset of severe headache, blurred vision, and epigastric pain indicates potential eclampsia or HELLP syndrome, requiring immediate notification of the healthcare provider for urgent intervention. Question 61. A patient at 28 weeks gestation with a history of hypertension presents with sudden epigastric pain and altered mental status. What condition should the nurse suspect? A. HELLP syndrome. B. Gestational diabetes. C. Placenta previa. D. Chorioamnionitis. Answer: A. Rationale: the symptoms suggest HELLP syndrome, hemolysis, elevated liver enzymes, low platelets, a severe complication of preeclampsia requiring immediate medical intervention. Question 62. A nurse is caring for a patient at 32 weeks gestation with a suspected intrauterine growth restriction, IUGR. Which diagnostic test is most appropriate to assess fetal well-being? A. Non-stress test, NST. B. Complete blood count, CBC. C. Glucose tolerance test, GTT. D. Urinalysis. Answer A. Rationale: a non-stress test, NST, is used to assess fetal well-being, especially in cases of intrauterine growth restriction, IUGR, by monitoring the fetal heart rate response to fetal movements. Question 63. A patient at 35 weeks gestation is admitted with preterm labor. Which medication is administered to inhibit contractions? A. Terbutaline. B. Betamethasone. C. Magnesium sulfate. D. Indomethacin. Answer A. Rationale: terbutaline is a tocolytic medication used to inhibit uterine contractions in preterm labor. Question 64. A nurse is monitoring a patient at 38 weeks gestation with gestational hypertension. Which symptom indicates a potential complication requiring urgent intervention? A. Proteinuria. B. Edema in the lower extremities. C. Headache and visual disturbances. D. Elevated fasting blood glucose. Answer C. Rationale: headache and visual disturbances in a patient with gestational hypertension suggest severe preeclampsia, which requires urgent intervention to prevent complications. Question 65. A patient at 36 weeks gestation presents with severe itching and jaundice. Which laboratory test is most relevant? A. Complete blood count, CBC. B. Liver function tests, LFTs. C. Urinalysis. D. Blood glucose levels. Answer B. Rationale: liver function tests are crucial to assess for intrahepatic cholestasis of pregnancy, which presents with symptoms of itching and jaundice. Question 66. A nurse is caring for a patient in labor with suspected cephalopelvic disproportion, CPD. What is the priority nursing intervention? A. Prepare the patient for a potential cesarean section. B. Encourage ambulation to facilitate labor progression. C. Administer oxytocin to augment labor. D. Apply a warm compress to the lower back. Answer A. Rationale: suspected cephalopelvic disproportion may necessitate a cesarean section to prevent complications during delivery, making preparation for surgery a priority. Question 67. A patient at 38 weeks gestation presents with painless vaginal bleeding. Which condition should the nurse suspect? A. Placenta previa. B. Placental abruption. C. Preterm labor. D. Chorioamnionitis. Answer A. Rationale: painless vaginal bleeding in the third trimester is indicative of placenta previa, which requires careful monitoring and potential intervention. Question 68. A nurse is assessing a patient with a history of preeclampsia who is now 36 weeks pregnant and presents with severe headache, visual disturbances, and epigastric pain. What is the most appropriate nursing intervention? A. Administer antihypertensive medication as ordered. B. Prepare the patient for immediate delivery. C. Monitor maternal vital signs and fetal heart rate. D. Notify the healthcare provider immediately. Answer D. Rationale: these symptoms indicate severe preeclampsia or potential eclampsia, requiring immediate notification of the healthcare provider for urgent intervention. Question 69. A patient at 30 weeks gestation presents with preterm premature rupture of membranes, PPROM. What is the primary nursing intervention? A. Administer corticosteroids to accelerate fetal lung maturity. B. Begin antibiotic therapy to prevent infection. C. Prepare for immediate delivery. D. Advise complete bed rest until delivery. Answer B. Rationale: antibiotic therapy is essential in PPROM to prevent infection, which poses significant risks to both mother and fetus. Question 70. A patient at 35 weeks gestation with a history of gestational diabetes presents with a fasting blood glucose level of 150 mg per deciliter. What is the most appropriate nursing action? A. Administer insulin as ordered. B. Advise the patient to reduce carbohydrate intake. C. Schedule a glucose tolerance test. D. Monitor fetal heart rate continuously. Answer: A. Rationale: administering insulin is necessary to control blood glucose levels in patients with gestational diabetes to prevent complications for both the mother and the fetus. Question 71. A patient at 34 weeks gestation is diagnosed with preterm labor. Which medication is administered to promote fetal lung maturity? A. Betamethasone. B. Magnesium sulfate. C. Terbutaline. D. Nifedipine. Answer: A. Rationale: betamethasone is a corticosteroid given to accelerate fetal lung maturity in cases of threatened preterm birth. Question 72. A nurse is assessing a patient at 36 weeks gestation with a suspected uterine rupture. Which symptom is most indicative of this condition? A. Severe abdominal pain and a sudden cessation of contractions. B. Painless vaginal bleeding and uterine tenderness. C. Foul-smelling amniotic fluid and fever. D. Lower back pain and decreased fetal movement. Answer: A. Rationale: severe abdominal pain and a sudden cessation of contractions are classic signs of uterine rupture, a medical emergency requiring immediate intervention. Question 73. A patient at 28 weeks gestation with a history of preeclampsia presents with sudden epigastric pain and altered mental status. What condition should the nurse suspect? A. HELP syndrome. B. Gestational diabetes. C. Placenta previa. D. Chorioamnionitis. Answer: A. Rationale: the symptoms suggest HELLP syndrome, hemolysis, elevated liver enzymes, low platelets, a severe complication of preeclampsia requiring immediate medical intervention. Question 74. A nurse is caring for a patient at 32 weeks gestation with a suspected intrauterine growth restriction, IUGR. Which diagnostic test is most appropriate to assess fetal well-being? A. Non-stress test, NST. B. Complete blood count, CBC. C. Glucose tolerance test, GTT. D. Urinalysis. Answer: A. Rationale: a non-stress test, NST, is used to assess fetal well-being, especially in cases of intrauterine growth restriction, IUGR, by monitoring the fetal heart rate response to fetal movements. Question 75. A patient at 35 weeks gestation is admitted with preterm labor. Which medication is administered to inhibit contractions? A. Terbutaline. B. Betamethasone. C. Magnesium sulfate. D. Indomethacin. Answer: A. Rationale: terbutaline is a tocolytic medication used to inhibit uterine contractions in preterm labor.